Expanding access to Medicaid in Wyoming could save thousands of lives.
I was a certified nursing assistant for most of my adult life, and my family has been in Wyoming for 3 generations. And now I have no job and no health insurance.
I've been ill for the last 7 years, and I haven't been able to get the health care that I need because I have no health insurance.
In 2020, I was diagnosed with pulmonary arterial hypertension, which is high blood pressure in the lungs. Since then, I've been diagnosed with congestive heart failure, COPD, and emphysema. The bottom line for me now is that I can't afford the health care that I desperately need.
When I was pregnant with my first son, I had PTSD, depression, and anxiety. And thanks to Medicaid, I was able to get counseling, which really saved me.
I qualified for Medicaid back then because I had a dependent child and very little income.
I applied for Medicaid, but they turned me down because even though I can no longer work, I was also turned down for disability. Medicaid said I need to be approved for disability before they'll consider my application. That would change if access to Medicaid were expanded in Wyoming.
Without Medicaid, I'm not sure I would be here today.
In the year 2015, I started having severe stomach issues. I would have rather had 10 babies all day long than to go through the pain that I went through. When I went to the doctor, I didn't have health care, so they really didn't want to see me.
Watching my mom not be able to get the care that she needs has been tough, especially when it's life-threatening.
Through the state of Wyoming, there is no opportunity for me in any way to get health insurance.
4 months ago, I was told I have a mass on my lung, and my doctor wanted me to get a PET scan, which costs thousands of dollars, and I have no way to get that. I became panicked and started calling anybody I thought might be able to help. I called Social Security, I called Medicaid.
It was late afternoon. She was in a lot of pain.
Yolanda took me to the emergency room over in Lander.
It was a good thing that we did when we did it, because she wouldn't be sitting here right now. She about died.
They ambulanced me from Lander to Casper. I was in surgery for seven and a half hours.
They told us that she had diverticulitis and her intestine almost exploded inside of her.
I woke up with a colostomy. Then I got in an infection and ended up with a big hole in my stomach. And on top of that, I ended up with 4 hernias, and I still have no health care. So they're not wanting to do a hernia surgery on me. Don't really know what's going to happen there.
I've been hospitalized 3 times in the past 6 months, and medical bills are piling up. They're astronomical. I have no idea how I'm going to pay them. The irony is that I've worked most of my life caring for others, and for most of my life I've been healthy. Now I'm sick and I need comprehensive health care, and I can't get it.
So it makes me feel kind of worthless because I'm not able to do, things that I used to be able to do with my family and my grandkids.
I work a low-paying job today that does not have health insurance, but I make too much to qualify for Medicaid and not enough to afford private health insurance. Expanding access to Medicaid in Wyoming would close that coverage gap.
If access to Medicaid was expanded in Wyoming, my life would be completely different.
If I had Medicaid, I'd be able to get my wound healed, and I would be able to get my hernias fixed.
I'd have peace of mind and feel better about my future. Instead, I'm terrified and depressed.
If I could talk to my legislator, I would ask them to expand Medicaid.
I feel like I'm out there in the middle of a field screaming for help and nobody hears me. There are thousands of Wyomingites in the same position as me. I hope our legislators in Cheyenne hear our voices.